Hello, my name is Mayra Casares, and this video has been done as an assignment for the course SWK 545, Generalist Social Work Practice 2, Groups, Communities, and Organizations at Grand Canyon University, and under the direction of Professor Lars Agerston on Wednesday, September 17th, 2025. This benchmark is for Topic 6, Community Problems Framework Video Presentation. In this presentation, I will be focusing on the incarcerated population in the United States and will be using a macro practice framework to address the needs and challenges and the opportunities of incarcerated populations. I will further discuss the written assignment for topic 2, identifying and describing the community's dimensions and its functions, as well as its members, the geographical boundaries, and the culture of the incarcerated community. According to the U.S. The Department of Justice in 2025, the Bureau's glossary defines the incarcerated as individuals who are held in prison or jail and are awaiting trial or have been sentenced to complete time. The purpose of the incarceration is to rehabilitate those that are incarcerated, pay retribution to its victims, deterrence of criminal activity in society, and incapacitation to prevent future crime by restricting offenders the ability to hurt the community and ensure public safety. The Federal Bureau of Prisons, BOP, and the state are the arenas in which macro practice takes place for those that are incarcerated. They run the prison system, facilitate for those that are serving a sentence longer than a year with felony criminal charges. The jails are ran by the city or the county and are known to incarcerate individuals that are serving a short-term sentence, awaiting a trial, or in many cases, the jails rent space out to the state or federal prisons to house their inmates. The incarcerated members come into contact with various staff. Um, Later, I will go ahead and describe the formal organization of staff. But there is also prison medical staff, prison dentists, prison psychologists, prison chaplains, prison teachers, correctional recreational staff who does the sports leagues, the hobbies, crafts, art programs, and much more. There are other staff such as food services as well. In the prison system, it's comprised of diverse and multicultural communities with different ethnic backgrounds, gender identities, cultural traditions, lived experiences, and they're looking for social equity. There are 98 federal prisons, 1,566 state prisons, and 3,116 local jails, 1,277 juvenile correctional facilities, and 133 immigration detention centers, and 80 Indian tribe jails and military prisons. The Federal Bureau of Prisons, BOP, again, report that federal prisons hold about 155,000 inmates in the United States, while state prisons house over 1 million individuals, and there are roughly 600,000 detainees in county jails. Nearly 2 million people are housed coasting the country. Approximately $182 billion are spent per year um, to house the incarcerated. The federal prisons demographics are 93%, approximately which equals to 1.7 millions are primarily male, and 130,000 are women. 45% are serving time for drug offenses. Data reveals that the U.S. incarcerated population shows that 32% of inmates are Black, 31% are white, 23% are Hispanic and other races. Ethnicity groups compose 14% of the incarcerated population, and the geographically And geographically, the incarcerated inmates are of different geographical areas throughout the United States. There's no set place of origin. They come from all regions of the country. The commonalities include committing a crime and being arrested for that particular incident that they um, decided to commit. And according to the National Institute for Healthcare Management, uh, the NIHCM Foundation gives data on the public health crisis of those that are incarcerated in United States prisons. Some of the needs that are represented by the NIHCM are the adverse effects on health that are left by the correctional environment, which is poor nutritional options, violence, excessive use of force, smoking, poor ventilation, overcrowding, isolation units, and sexual abuse. Chronic conditions and infectious diseases that are encountered while incarcerated in state and federal prisons are 30.2% high blood pressure, um, 14.9 with asthma, 9.8% with heart-related problems, and 9.0 have diabetes, 1.8 have stroke-related problems, and 1.8 have cirrhosis of the liver. People with history of incarceration have poor physical health compared to the general population that have lower percentages. The prevalence of infectious diseases are again compared to the general population. And those are HIV and AIDS, hepatitis C, and tuberculosis are most common in correctional environments. Commonly, sexual transmitted diseases are also prevalent among the individuals. Mental health and substance use are challenges for those that are incarcerated. Women have been reported to be more likely than men to have history of mental health problems in state and federal prisons. 21.3% of men have mental health in federal prisons. 51.9 of women have mental health problems in federal prisons, where 40.9% of men have it in the same have it in the state prison, and 68.7 of women have it in state prison. The prevalence history of mental health problems are major depressive disorders with 27.1%, bipolar diseases with 13.7%, anxiety disorders with 22.2%, PTSD with 14.1%, personalities disorders with 11.4%. Those numbers are from those that are incarcerated in state prisons. The number of states are higher than those that are in federal prisons. Okay, um, drugs and alcohol intoxication related deaths in states and federal prisons are difficult to measure in research, but it is estimated that 65% of the U.S. prison population has an active substance use disorder. People with a history of mental illnesses and substance use disorders also have higher recidivism rates. The health and well-being in the reentry population is that of 95% of people in prison are eventually released. Their health is imperative to the long-term community-based health care systems. On average, the incarcerated adults are released from correctional facilities with more chronic medical problems than they had before admission. And the evidence suggests that negative health consequences of incarceration not only affect those that have experienced it, but also by their families and the individuals in the communities, it is estimated that 113 million adults have had an immediate family member incarcerated. People who are re-entering communities after incarceration face complex and unique barriers to access resources and other support systems and programs. The reentry population have disproportionate rates of mental health issues, suicide, disability, chronic physical disorders, substance use disorders. They cause and being previously incarcerated can affect a person's ability to secure basic needs such as healthcare, housing, and employment. Um, the focus on community assets, the incarcerated population is not seen in society as a value. They are seen as a cost to the government. The only value that is seen, as I mentioned before, is the purpose of incarceration, which is the retribution to the victim, deterring the crime, and have safer communities. Those that are incarcerated have strengths and resilience that can be seen in as positive outcomes. Many inmates are looking into empowering their education while being incarcerated, such as their GED, vocational training. Some even make it into 4-year colleges, um, which reduces the recidivism rate. They become physically fit through body weight exercises that help release any negative emotions and build mental resilience. They start receiving religious supports that help inmates cope with the tolls of being incarcerated, as well as providing hope, guidance, and a sense of purpose. While inmates participate in these groups, they are able to form social bonds and they maintain a sense of support. If they have the resources such as mental health that then need a while incarcerated, they are able to build resilience through life skills and they build their character strengths with values such as gratitude, self-control, and spiritual well-being. In terms of power structures, formal leaderships include the official hierarchy function of the prison system, which starts with the wardens, who are the chief executive officers who report to the Federal Bureau of Prison Directors. The warden oversees the growing numbers of multi-security levels. They supervise as many as 5,000 inmates and hundreds of employees. The wardens will also implement policy and procedures to prevent violence and maintain order and make sure that uh, they're following state and federal laws and looking out for inmates' rights. Most inmates will not interact with wardens or any other executive staff, yet wardens are the final arbiters of all issues that need to be resolved at the institutional level. They also ensure inmates have access to healthcare, education, and vocational training, and collaborate with organizations to provide services for inmates' rehabilitation while incarcerated. Next would be the associate wardens who are directly below the warden supervised. The warden, they supervise different operational areas as they are more available to the inmates. Correctional captains would be following the assistant wardens, and they supervise all correctional officers at the federal prison facilities. The correctional lieutenants are the ones that overrule the non-correctional staff. They are usually present whenever the inmates have a medical appointment or are being transferred to a different prison. They are the decision makers and initiate investigations and initial processing of prison disciplinary matters. For example, he decides if the inmate gets to solitary confinement or receives a different punishment. Correctional officers are the federal prison frontline individuals They ensure order and they lock and unlock cells and doors. They conduct inmate counts and search for contraband. They complete reports and issue disciplinary citations and when there's any issues. There are also there are also unit teams that include a unit manager, and they are responsible to oversee the entire staff of the unit, and they determine the inmate's classification status, housing, and other matters. The case managers usually manage the custody and classification proceedings. Correctional counselors assist in inmate housing unit orientation, inmate work assignments, supervising, hiring and paying the inmate workers, facilitating inmate self-help groups like Alcoholic Anonymous, Narcotic Anonymous, anger management, clearance for visitors, distribution of cell sanitation supplies, and much more resourceful tasks. The unit secretary handles all of the administrative matters for the unit. The informal leaders of the incarcerated and prisons social hierarchy start with the serial killers, murderers, drug dealers, robbers, burglars, abusers, and rapists would be the ones that are in the bottom and the ones that run with the most risk of being murdered inside the prison system. Members of Congress are the senators who have a duty to respond to the needs of their constituents. Although a person in prison may not be a voter, that person is still a constituent. The family is also considered a constituent and may write a letter on the incarcerated individual's behalf. Some of the social policies that are impacting the incarcerated well-being services delivery and access to social services are the policymakers' efforts to provide expanding medical coverage once they are released into the communities and be able to receive physical and behavioral health services. Some of the formal organizations that assist in providing services to the incarcerated after being released are the Behavioral Health Department, the Human Social Services, Unemployment, Social Security, Disability, or SSI, SSP, Housing, the Housing Unit Department. All of these resources make it accessible for them to get benefits within these organizations. The accessibility of community health infrastructures is mental health and substance use treatment programs, where it is not hard to enroll into these programs. As for some are significantly overloaded with administrative burdens, meaning they would just request so much information that sometimes inmates do not possess as they are released uh, uh, from prison or jail. They have lost all of their belongings and it's hard for them to get it. So one of the burdens that they find themselves is going through all these administrative requests to be able to qualify for programs. The availability of receiving supplemental nutrition assistance program, which is also known as food stamps, um, is to be able to eat. It, these are programs that are there and available so that they can utilize. Meanwhile, they get back into the workforce or decide what they're going to be doing um, to be able to get financial resources. Passing automatic records would be used by the legal department. So they would need legal assistance for expungement measures at the state and federal levels um, so that they can go ahead and secure employment. Some of the programs that have been authorized are the second chance Change Reauthorization Act of 2024 that reauthorizes the Second Chance Act of 20 2008. And these are programs that are geared towards improving reentry, and it supports behavioral health programs. Another would be the Second Chance Act Crisis Stabilization and Community Reentry Program to provide funding to state and local governments to support the implementation of clinical and recovery supports after being released. There are other programs that are um, followed inside the incarceration process um, that are there to help the inmates before their release, so that they can better survive once they are released. Some of the treatments that are available locally are community-based substance use treatment program. Those that have a substance use disorder are the leading, which substance use disorder is the leading cause of death within 2 weeks post-release due to overdosing, according to Bartholomew Skowronski and Elizabeth Talik, who wrote in an article Quality of Life and its correlate in people serving prison sentences in penitentiary institutions. Some of the informal system encompass 8 networks, family supports, church-based support groups, Alcoholic Anonymous, Narcotic Anonymous, their sponsors, and their social workers. At this time, they will also be seen by either a parole officer or probation officer that will go ahead and facilitate more assistance so that they can go ahead and um, stay away from reentry into the prison system. After speaking with an individual, Stanley, he is a resident at a local shelter ran by the city. Um, he was able to share his experience of being incarcerated on 3 different occasions for 5 years was the first time. And then he came out and was uh, in and out of prison for petty crimes, serving um 10 days, serving 30 days. It was just jail issues. And and the last time he served 6 months, and he has been an active meth user for over 30 years. And he was sharing that upon his release, it resulted in him being diagnosed with chronic hepatitis C and is currently receiving treatment for it. But he stated that he is worried because they told him he will not qualify for a liver transplant because he has not been clean for a long period of time. And these are some of the outcomes for criminal life involvement with him and many other incarcerated uh, people that have chosen that path. They come out with different medical diagnosis, and if they are not treated right away, they run with the risks of not being treated at all. Um, one of the other ladies that I spoke with, she served a 2-year sentence in jail and was released to a sober living recovery program to complete 2 more years in this place to be able to recover from her uh, drug substance use. She was a marijuana smoker, but what got her into prison was um, she was charged with child abuse, um, physical child abuse, because towards her daughter, because she threw a hard plastic container, and it hit her on on the head. It slit piece of the head with the impact, and she was under the influence of marijuana. So she was released onto the program to, since this was her first offense, to be able to deal with her marijuana addiction while she participated in the program for 2 years. And after she did that, then she would go ahead and be released back into society. Um, as of now, she mentioned that she is working towards her master's degree. So that has a beautiful ending there. We can see how the motivation and the change of being an alternative, of being able to enter into this recovery program has helped her in many cases and in her future level here in society. Now she's going to be able to serve and be a citizen um, and self-sufficient as well. Um, this determination by the criminal justice system was a successful reintegration and will be actually a successful reintegration into society after she completes her release. The personal experiences show that ongoing inequalities, but also the resiliency among the various challenges that individuals face on an everyday basis. The social problems that are faced by incarcerated individuals have to be addressed by social workers by providing biopsychosocial interviewing and finding out the root cause of the needs of the inmates. This way they can be helped and be provided the necessary resources and advocating policies that support their reintegration into society when it's safe to do so. Um, some of them there is a cause, trauma um, that they've experienced when they were young. And these are things that need to come out because these are triggering aspects of of not being able to cope with those emotions. So by going into the root cause, it might help them be able to um, know what their triggers are. My working hypothesis is that improving the mental health while incarcerated and trying to get them into as many resources where they can get educated and linked with support groups will improve the success of post-release decreasing the numbers in recidivism. Inmates need to be redirected and allowed to find their strengths within and find solutions for those worries and weaknesses. Motivation plays a huge role in addressing many issues that they face. The sense of purpose and reunification with their families can be the motivation. So we need to pull in the family to be part of the goal settings and case plans. Um, Policymakers should also consider the results of research that have been done to expand and improve prison education and other prison services, as it will not only be a matter of justice, but also an investment in public safety and community well-being. These inmates can rehabilitate and set them, and they can be set up for post-release success. This concludes my presentation. I have the three, well, actually more than the three pictures that we were required to show, which first one is incarcerated. Why did I do it? Usually when people go in, they have somehow feel remorse. So here we see that he's thinking about what he did. Maybe he's trying to cope. Um, and then we go on to it's not too late. It's not too late to get an education, to go ahead and fulfill those needs that are going to better their future um, in the long run. And then Miss Social Worker, I want to get educated and see education empowers, education gives resilience and kind of cuts the chains of being um held back in a sense. Here we can see this social worker and the um correction officer, family reunification, and here's someone getting educated. It will it ultimately be into this um when people start getting educated. And then staying safe inside um HIV and hepatitis C healthcare in prison. These are one of the highest um diseases that happen inside of the prison system. And then overcrowding in the prison system is also another issue. And this concludes my presentation. Um, thank you and have a great day.